people have asked, when is a paniculectomy or a tummy tuck appropriate after weight loss surgery or after weight loss of any kind? I've had a lot of patients in my practice who have undergone medically supervised weight loss who have then lost a great deal of weight and then have been left with this pannus or roll along the abdomen that they've wanted to have removed. Likewise, I have a great number of patients who've had weight loss surgery and have lost a great deal of weight and then have this same roll or pannus, and they've asked, should I have it removed? Is there any other way to have it removed other than surgery? And what's the best timing for removing it? So I'll try to answer those questions a little bit. First off, there really is no way of satisfactorily removing or dealing with this excess roll or pannus short of removing it surgically. So-called excess skin is really kind of the leftover from excess fat that's melted away. So for starters, we should think of it as a good thing. It's a whole lot healthier to have a roll of excess skin rather than to have that excess subcutaneous fat, which makes us much less healthy and is much worse for our overall sense of well-being and energy level and longevity. So it's a good problem to have. It means that you've accomplished something really important by losing a lot of weight. Next, the question is, should I have it removed? And for many people, that depends on how it feels to them. For some people, they're getting skin abrasions, irritations, sometimes fungal infections underneath the roll, and yes, they really should have it removed. For most people, though, it's a matter of how it looks and feels to them. It's kind of a sign of graduating through this process and moving forward in life. And so it's something that they want to have removed. And I always support their efforts to have it removed and encourage people to do it. And next the question is, when should it be removed? My answer there is that generally speaking, one should wait until they think that they've reached a fairly steady place with their weight. They're at their nadir or they're at their low point or a place where they think they'll be pretty stable for a while. And usually that's a good year or year and a half or two after working hard at surgical weight loss or at medically supervised weight loss. And once you've hit that point, then it's a really good time to think of paniculectomy or tummy tuck type procedure as kind of a milestone that is sometimes a good celebratory milestone, but a place to move forward in life. It does involve surgery, and all surgery has risks. The main risk here is of non-healing or slow healing of this wound that is then created after the surgical incisions. One winds up with a long transverse incision that goes all the way around back to the hips, and so that scar will be there forever. It kind of trades this roll for a scar. There's no way to do these procedures without leaving some scar. And also the belly button can either be removed or it can be reimplanted, and that's a choice that a person can make. Plastic surgeons, cosmetic surgeons generally do this procedure quite well. It's something that's right in their armamentarium of procedures they offer. And many bariatric surgeons do this procedure, as I do that. Sometimes a bariatric surgeon or general surgeon may also fix a hernia that may be present at the abdominal wall at the same time. For example, if someone has had previous abdominal surgery and the old scar has left a hernia or a weak spot, then this may be the time to do both the paniculectomy or tummy tuck at the same time as the hernia repair. And that's a fairly common question that people ask me, and that's a fairly common procedure that I will do for my patients. I do try to prepare people that it takes time for this to all heal, but it's usually very successful, and usually people are very happy with the results as long as they know just exactly what they're getting into, and they plan for several weeks of recovery time afterwards. But overall, I think most people are very happy with the results afterwards and have a more stabilized and more satisfactory abdominal wall and abdominal appearance.